guys, Dr. Krautsack here, and today with Jackie, who's been an amazing patient in the office. And so, Jackie, you've been under care for a few months now.
Mm-hmm.
And why did you originally come in?
I was having a lot of back and neck pain, and it was starting to affect other areas of my life. Shoulder pain, numbness and tingling in my hands and fingers, and I knew something wasn't right. And I was honestly so used to being in pain, and I was just tired of it and wanted to change it. So
It's old quick, right?
very quick.
And so what else, were you doing anything else just to manage the pain? Were you taking medications or anything like that? Like, what was your go-to?
Yeah, so on a pretty regular basis, I was taking ibuprofen, probably 1,000 milligrams. And when things would get really bad, you know, a muscle relaxer, just because everything was so out of whack, and my muscles would tense up, and it would cause headaches, really, really bad, almost migraine-like headaches in my neck and shoulders, and just not being able to sit for very long. Car rides were miserable. There was just a lot of things that...
yeah, and that was going on for how long?
Oh, several years.
So several years, okay.
Yeah, so several years, and you know, it started out being just pain here and there, and then it got to the point where the pain was all the time consistent, and I was like, this is insanity. Like, there's got to be something better than this. I need to change some things. So
it was getting worse to the point where it was like really affecting your daily life, right?
oh yeah, yeah.
Okay.
It's hard to work. It's hard to stand in the kitchen and cook dinner. It's hard to sit in a car to go visit people or go take a trip. Forget exercising. Walking even was hurting me. There's no amount of weightlifting or any other kind of exercise that didn't cause me pain, bad pain. And so it was, I had this glimpse of myself starting to be somebody who was going to be sitting on the couch a lot, and I did not like that.
Yeah, that's kind of fun. So yeah, obviously you've been through a lot, and you came in, so we did adjustments, you've been doing the rehab, the exercises, so we want to honor you for doing that, right? You put in the effort, you put in the work. But yeah, how are you feeling now, and what would you say has been the result?
I mean, I have noticed some huge changes. Most of the time I'm noticing little changes, just little differences in things. But overall, the pain is less, the tingling in my hands and fingers is gone. Headaches, I'm not getting headaches anymore. And I can, you know, go out for a walk. I can stand at a concert for 3 hours on my feet the entire time.
Awesome.
I can go to a parade and stand for hours, and it doesn't bother me. I just feel like a normal person. I feel like I can do the things that I want to do, and my body is not, you know, punishing me for it.
Absolutely, and that's what it's about. And so once again, we want to honor you for putting in the work. And I always tell people, right, you got to show up. That's the first step. You know, we work hard to get people better. But she came in, she did all her exercises, working with Carter, working with myself, getting adjusted. And that consistency and that repetition is just like going to the gym, right? So you already mentioned you feel stronger, right? You can stand longer, walk farther, the numbness is gone. What would you tell someone who's, you know, struggling or in pain right now?
I mean, they should come in and see you for sure. And you know, I guess just dare to imagine that things could be better, and that you don't have to accept where you're at, and you don't have to take medication that makes you feel bad. You can get relief in a different way, and it's relief that's permanent. It's a permanent change, not you know, just a band-aid to throw on something.
Absolutely. We tell people every day your body's healing. We got to get you more. We got to get you stronger, right? We got to get you more resilient. Awesome. And thank you so much for talking to us today.
Absolutely.
Thank you so much for watching. We'll see you in the next video.